Okay, well, welcome everyone. My name is Suzie Riddell. I am the CEO of Social Ventures Australia, and I really want to get us started today by acknowledging the traditional custodians of the lands that we are joining on in person here on Wurundjeri and Bunurong land as part of the Kulin Nation, and acknowledge the traditional custodians of this land and the many, many lands that people are joining from online who are joining us today. I want to pay my respects to the elders of the past and of the present, extend that respect to our First Nations leaders who are with us today, and accept the very generous invitation in the Uluru Statement from the Heart to walk together towards a brighter future. One which I believe and our organisation believes will be brighter with a constitutionally enshrined voice to Parliament. And I hope that many of you are engaging in conversations about what the upcoming referendum may mean for you, for First Nations communities and families, and really importantly for First Nations children, given the topic that we're talking about today. On behalf of SVA and the Centre for Community Child Health at the Murdoch Children's Research Institute, I'm thrilled that we're having this event. So welcome to our studio audience who are here in person, to our at-home audience who are all joining online. We are recording this event, which is going to mean that you can share this with friends and colleagues who may not have the opportunity to join us today, or if there's so much tantalising content, you'll be able to re-watch it for all those brilliant insights that we're going to hear today. Social Ventures Australia is a not-for-profit organisation, and we have a vision of an Australia where all people and communities thrive. An absolutely essential component of that is getting a great start in life. Early childhood development is a really key area of focus for us. And I know you already know that's because getting a great start in life sets you up well for a future of possibilities and great outcomes, including for the next generation. It's a really exciting time in Australia at the moment. If you're an early childhood practitioner, academic, aficionado, parent, family, potential child waiting to be born, it's the result of the work of many, many people operating at many, many layers and influencing at the community level, political level, in local areas, at the state level and at the national level. We've seen a lot of strong mobilisation of collective efforts, which is brilliant to see, where we're looking to coordinate within the sector with initiatives like Thrive by 5, the Starting Better guarantee work that's been led by the Centre for Policy Development, the Early Years Catalyst, the Investment Dialogue, which is bringing together government and philanthropy, the National Child and Family Hubs Network, and this is just a couple of them. People are really seeing the opportunity that if we come together and work collaboratively with complementary skills and networks, that we are at our absolute best for being able to influence real change. The election of the Albanese government last year also brought about a really renewed political interest at the national level in early childhood development, and we've already seen the momentum that the early years strategy has been creating in catalysing people to collaborate and to distill and crystallise, well, what would we want to see done differently and what would it take to really change the trajectory of young children's lives and of their families and better support education, wellbeing and development of all children in Australia. So at the state level, we've seen New South Wales and Victoria committing to really significant increases in early childhood education service and delivery with a really specific focus on preschool. And we've seen in South Australia, the Royal Commission going ahead and lots of recommendations and a lot of opportunity to participate in that so far. So I imagine most of you know it's really a once in a generation moment in time to bring our knowledge, our networks, our energy, our passion, our commitment to seeing change together to really realise some of the potential we all know has been there the whole time to transform the lives of young children, and particularly in an ongoing way that creates positive ripple effects. So it's a critical time for dialogue about how our early childhood systems could be better. What would that really look like? What are some of the opportunities and the components? And at SVA and in many of your organisations and in your areas of influence, that focus is really on those who experience disadvantage and vulnerability. We want systems that work for everyone, including those who don't have all the things that they might need in order to lead a flourishing life automatically. So this is really complex and hard. It requires a lot of different things to happen at many different layers in the system. And no one is here to pretend that there are silver bullets or things that we can take off a shelf and press play and that they will easily remedy situations that have been in place for a very long time. We know, and we'll hear examples about what it will require in terms of coordination, collaboration, alignment of the sector around the key strategies so that we are working towards common goals in order to see the change that we really want to see realised. Part of that is the early learning system, and early childhood education is critical, and there's more to the picture in terms of early childhood development and ensuring that kids are getting a great start in life. So part of the conversation today is about broadening that to ensure that children and their families have all the right ingredients that they need to thrive. So our conversation today seeks to contribute to the conversation by sharing 2 new pieces of research about child and family centres specifically and the role that they can play in combination with other strategies in reshaping the system, and how families are able to connect and access the supports that they need to thrive with these models. It's an area that we believe is really appropriate and complementary and fits in well with the early years strategy, the federal government's work. We want to see a commitment to those child and family centres being part of the solutions going forward. We want them to be optimised for impact and available in the first instance for the kids who are experiencing the most vulnerability and disadvantage, meeting the greatest need in the places where those children and families live. So I'm really looking forward to today's conversation where we will dig into what is the current landscape, what are the sets of opportunities, how big is the need, what might it take in order to be able to deliver some of these exciting opportunities for Australia's young people. So to introduce this work and to introduce our panellists and lead us into the conversation, it's my pleasure to invite one of our superstars at SVA, my colleague Emma Sydenham, who is talented, well she can speak in real sentences as well, well versed in all of these issues and incredibly connected to brilliant partners who have contributed to all of this, from whom we will hear today. So over to you, Emma, and your eloquence.
Fantastic. Thank you so much, Susie, and good afternoon, everyone. It is very exciting to be here today with you, to be actually having a real conversation in the flesh. It's been a long time and it's been a big build up to having this, so it's great to see some faces here, some faces next to me, and really look forward to this conversation. So what we're doing today is sort of soft launching or pre-launching some work that's part of a broader program of work that Social Ventures Australia with the Centre for Community Child Health within the Murdoch Children's Research Institute are progressing to mobilise the potential of integrated child and family centres, and particularly for children experiencing disadvantage. Now, by integrated child and family centres, CFCs, ICFCs, what we're talking about is a service and a social hub, and really community designed and delivered, where children can access key services and also critically connect with other families and build social connections. So there's a range of services from the early childhood education and care, early learning programs, child and maternal health, family support programs, but also providing either access to or facilitating as a kind of navigator access to a broader tier group of services for families experiencing much more complex or challenging issues in their life. Now, these are one of a number of types of hub models in Australia that are all gathering together at the moment under the National Child and Family Hubs Network, which is an exciting network we'll share more on a little bit later today. Now, these services are relevant for all children and families and should really be a part of our social fabric, but they're not. And so for us, we're really prioritising those children who are being left behind at the moment, who would really serve to benefit most from this work, and we really need to prioritise in on them. Now, we're convinced by the evidence around this emerging ICFC sector that it can really fill an important gap in the early years environment. at the moment and see really great potential for impact. And the ways in which our organisations feel that we can add value and really focused on are around building the evidence to better understand that potential, what it looks like, how we replicate, how we scale, building sector capability as a sort of new and emerging sector to support leaders and service providers to be able to implement equality and grow and learn together, and advocating for structural reform to make sure we do have the right policy and funding mechanisms in place to see all those kids that need it have access. So as part of that work, we're sharing today two exciting new pieces of work, looking at their implications and how we can best grow and strengthen this sector. So the first piece is a discussion paper that's been led by our very own Caitlin Graham here, called Enhancing the Impact of Integrated Child and Family Centres in Australia. And it's really looking at a number of the key Australian ICFC models and really digging in deeply to interrogate what are the enablers and barriers to them seeing success, which is impact for children and families on the ground. What are the operational policy funding structures that we need to support them be high quality, but also to support at scale? The second piece is a piece that we've commissioned with Murdoch Children's Research Institute from Deloitte Access Economics to progress a discussion of how we move to where we are to a national framework or a national approach for ICFCs. So the work that they've done really looks at what's the extent of child development and wellbeing needs across the country. Where is that need? How big is it? How could we best redress it? And the second is really looking at how can we best fund this at scale and see it sort of embedded within the early years system. And this is really sort of a starting point, and there's lots more to explore in what that national framework could look like, but we're really excited to start seeing some of the outline of what that could look like and how it could take shape. So to get on with it, I'd like to introduce our fabulous panel here. We have Tim Moore, who's calling in. Sadly, we're going to zoom him onto the screen in a second, who really needs no introduction. He's a senior research fellow at CCCH within MCRI, and he's really a preeminent researcher, both in Australia but also internationally in this field. So I always feel safe when he's in the room, and I really just want to be popped in his pocket to go along and listen. I could listen to Tim for hours and learn enormously. We have Caitlin Graham, our early childhood policy manager, who has spent many years in the social policy area, and I think feels like she spent just as much time working on this discussion paper. We have Cassy Bishop, who's the manager of the Cairns and Gordonvale early years centres in Queensland, who's got many years experience across the human services sector. And last but not least, we have Lachlan Smirl, who's a partner here at Deloitte Access Economics, who leads their education policy practice there and has really had his finger in most of the big national and state level reviews across the education sphere over the last decade. So very excited and delighted that you are all here today. Thank you. And guests in here and online, we would love to hear from you. Please send through online your questions as they come up. We'll try and keep a record of those, and we'll have a solid, hopefully, discussion time at the end where we'd love to hear your thoughts and questions. So Tim, zooming into you to kick off, you have done enormous research in this space over the years. We would love to hear you recap for us really where we are at. What's your understanding of the experience of children and families across Australia at the moment? What's sort of the need or the problem that we're seeking to address here?
Okay, am I on? Thank you very much for the introduction, and I'm really sorry not to be able to join you in person or for all of the meeting. Okay, so what's the problem that we are seeking to address in what we're in right at the moment? Basically, we've got we've seen rapid and unprecedented social and economic and demographic and technological changes over the past half century or so, and they've had the effect of dramatically altering the conditions under which we are living, and particularly the conditions under which families are raising young kids. Now, these changes have had enormous improvements in general prosperity and standards of living, etc., but the benefits have not been equally distributed, and there's a widening gap between those who are benefiting and those who are not. And these social changes have also altered the nature of the problems we're facing. We're more likely to be facing complex or wicked problems, and these are not able to be effectively addressed through the traditional policies and services. Another point is that the service system hasn't kept pace with these changing conditions. It's still planned, funded and administered in ways that were originally designed decades ago, when society was less diverse, social conditions were simpler. And the siloed nature of the service system prevents services being delivered in an integrated fashion. We still deliver them in departmental silos. Now, in trying to tackle these kinds of problems, our default approach has been to focus on services rather than on the conditions under which families are raising young kids. Services are important, but conditions may actually play a more important role, and the neglect of this is a problem. The bottom line is that the existing system has not yet made a major difference at a population level to the major complex problems we are seeking to address. Poor school readiness, child protection rates, family violence, intergenerational poverty, etc. These major problems we may have made a difference in individual programs, or at the population level, they're not shifting, and this is very frustrating. So, where do we go? What do we do? In trying to think about this, I went back. I'm a child psychologist. I always go back to the developmental literature to try and remind myself what are the core things we need to pay attention to. And I reviewed the core care conditions that children and parents need. Now, we're familiar with the core care conditions that kids need, but we focus less on what families need. And yet the ability of families to provide children with the conditions that they need to flourish is shaped by the extent to which their own core care needs are being met. And foremost among these is the need for social support. Every parent needs unconditional care from at least one other person, and every family needs to find its own tribe, its own backup group. You may be familiar with a famous quote from psychologist Urie Bronfenbrenner, who said, of children, somebody's got to be crazy about that kid. And we understand that, and we are focused on building attachment and support for children. We're less familiar with what Urie went on to say, which is that, in effect, someone's also got to be crazy about that parent, because in order for the parent to provide the child with unconditional care, somebody's got to be giving it to them as well. And we need to think about whether we are providing the conditions under which families will have or find such people. The 2 or 3 core people who provide unconditional support, and then the wider group of families who are their tribe, their backup group to whom they belong. The core care conditions for parents also include local community, environment, the physical, social, and so on, and of course the broader social determinants of health and well-being. And one of the things that's important for us to remember is that the conditions under which families live have a larger impact on their health and well-being than do the services they receive. The services still have a significant impact, but it's the conditions that we need to think about. So let's just focus on the question of what is the experience of children and families across Australia today. Where our feeling is, we think the evidence supports this, that we actually need to start from a different place. We need to begin with the lived experience of children and families and reconfigure our existing resources to address the issues that they see as most salient. This is in contrast to the approach of us deciding what problems families have and designing what services they need and building them where we think they need to be. And I think we need to do a kind of thought experiment, or indeed do some actual investigation as to what it's like to be a parent of a brand new baby. What do you see in front of you? Where do you go to meet other families? Where do you access services? And while many families have got good supports from their extended families and good personal resources, and therefore do know where to go, many are not so fortunate. And for those families, it's not clear how and where they can meet other families and how they can access and mainstream other services. There aren't obvious places where they can go. And this leaves too many families with inadequate social supports and limited access to services. So this is where ICFCs come in. They can act, as Emma said, both as a social hub and a service hub, a natural place in the local community for families with young kids to go and to connect with other families and to get access to a range of services. The ICFCs can provide mainstream support services as well as tiered systems of support to address additional child and family needs. And of course, to make sure they're acceptable and used by families, they need to be co-designed and co-produced with local communities and families. So the ICFCs have the capacity to address some, at least, of the social and service problems that we're now facing. There are limits on what they can do. They need to be complemented by broader place-based supports that address what the local community supports, how they support families, and by enabling policies at government levels that address the social determinants, poverty, housing, and employment. So we need to re-envision the entire early years environment for young kids. We need to go beyond trying to improve the services for those affected and rethink the environments in which families are raising young kids. And if we can get those conditions for children and families right, we believe we will then get better outcomes. And I'll stop there.
Today. Cassy, you work with the lived experience, as Tim spoke about, of children and families every day. How does that resonate with you, and what kind of supports, what does it look like on the ground to run an ICFC? You can bring that to life a little bit for us.
Okay. So more broadly, the Benevolent Society has 3 early years places in Queensland, which are funded by the Department of Education. We have one in Gold Coast, one in Brisbane, and I manage the centres in Cairns. So we operate on a satellite model. So we have a main centre, which is in one spot, and then we have 2 satellites. One satellite has an established early years place building, and in the other we just use community resources such as neighbourhood centres and community centres to deliver what we need to deliver. So basically the model is based on a proportionate universalism. So we deliver playgroups, parenting programs, but we also deliver family support. So everything's free. Families can come in. We also have partnerships, with Queensland Health and a local Aboriginal wellbeing service. So families can come in to a drop-in clinic, a newborn drop-in clinic at Queensland Health, or to see a midwife while they're pregnant. And then they can graduate to attending a baby group, and then from there attend a play group. And then from there we have a kindergarten on one of our sites as well. So, and in our Brisbane Centre we also have a long daycare, so they can then graduate to kindergarten and then onto school. So our centres tend to also be based on school grounds as well. So we kind of have that relationship with the community. And I think the partnerships are definitely key with Queensland Health and the Aboriginal Wellbeing Service. We wouldn't be able to deliver the groups and stuff as well as we do without them. So we have child health nurses in all of our groups, essentially. They support us to deliver the parenting programs as well. They sit at our centre, so they're actually part of our team. They're not separate to our team. And we also have the 2 staff from the Indigenous Health Service who also sit at our centres and are part of our team as well. And they support, you know, our activities with Aboriginal and Torres Strait Islander families, but also with supporting our team to build their skills in working with Aboriginal and Torres Strait Islander families. I can give so many examples of people who've come through. I've been working in the centre now for 10 years. And just seeing, we have families who had their first child and now are on their 5th, and they've all gone through all of our groups and our kindergartens, and they just, you know, their feedback is always that without our centres, without the social supports that they gain, that, you know, they don't know what they would have done, basically. So, but one good example that I have is actually one of my staff who actually started out as a parent who was referred to our service. One of our programs is called Explorers, and it's for children who have a disability or parents suspect they have a disability. And one thing I did forget to mention, which I knew we would, is that we also have OT and speech pathologists on staff as well. So we have Allied Health. So that group is supported by Allied Health, our own Allied Health, but also brokered Allied Health. So we do broker them in as well. So she came along to this group. She has an intellectual impairment herself, came along to the group, was supported with that group each week to get the necessary diagnosis for her child. She then enrolled her child in our kindergarten and did 2 years of kindergarten with us. But we also have Allied Health that support our kindergarten on a weekly basis as well. So we have, because we do have that group, we get a lot of children with additional needs in our kindergarten. So we have additional staff, which we can, you know, fund through the Department of Education funding that we receive, as well as brokered Allied Health and our own Allied Health. So her little girl is now in school, but from there she wanted to give back. So she also came on board as a volunteer with us, and then through her employment agency they asked if we could take her on as a casual employee, and now she's a part-time employee with us. So that's just one example, I guess, of how we can support people. And I guess the flexibility of the Department of Education funding has really kind of helped with that. We're not tied down to what we must do. They don't stipulate you have to do this, this and this. It's basically outcomes focused, and they expect us to do that through the universal delivery mostly of playgroups and parenting programs, but also that one-on-one family support where it's needed by families. And I guess the beauty of the universal is that soft entry approach. So they can come in, build relationships, build trust. And then when they do have an issue, they feel comfortable because they're seeing the same staff every week. They can feel comfortable to go and have that conversation. And then, you know, the staff member will say, well, you know, maybe we need to provide you a little bit more one-on-one support. So let's do an intake and let's help you with that. So,
yeah. Thank you. Caitlin, so that's a story of sort of 3 centres, and they're very diverse and flexible supports that are provided. Can you share with us kind of what the broader sector looks like?
Yeah, thanks, Cassy. It's always so good hearing the reality of what these centres look like. So in Australia currently, there's about 209 of these centres across the country. There's a huge diversity. It's quite a patchwork at the moment because there's no sort of overarching structure for how these centres are being rolled out. So we've got 6 state-based or jurisdictionally based models in operation at the moment. So that's not going to forget any, Tasmania, South Australia, Western Australia, the Northern Territory, Queensland and the ACT. And all of those are being run by their respective government, usually out of the Department of Education. And they're all being run at various levels of scale. There's quite a lot of difference across the models. So you've got, say, Tasmania, which is a very centralised operation. The Tasmanian government owns and operates all of their centres, versus, say, Queensland, where the Queensland government funds not-for-profit organisations to run them. So they've got 56 across the state. And you have some centres that are large, such as Cassy Centre, that will have 10 staff and lots of children coming, and others that have one staff member, very small, working with lots of partnerships. So it's a huge spectrum. And then on top of that, so in Victoria, we have the Our Place approach, and that's being delivered by philanthropy and in partnership with the Victorian government. And that's rolled out to 10 sites across Victoria at the moment. And then we have the Aboriginal and Torres Strait Islander integrated early year centres. So there's about 75 of those, though a number have been sort of subsumed into state-led models. There's two different models that we kind of speak about there, which are the multifunctional Aboriginal Children's Services and the Aboriginal Child and Family Centres. Of the 75, about 75% are Aboriginal community-controlled organisations. And they're being delivered. There's a huge variety across those models based on essentially what funding they're able to access. It's a very different funding model. And there's a big spread. Some are able to deliver such complex, sophisticated programs, and others at the moment are really running long daycare because they can't get enough funding to support them for the more integrated components. So what we know from the research essentially is that there are pockets of brilliance. There's 209 of these centres across the country. If you live in one of those areas that has a centre, it's fantastic for children and families, but there is a significant majority of children who are unable to access one of these centres because it just isn't where they live.
So there's lots of information that just wants to explode from your body on this. She's been holding it in for a long time. So you've been talking to a lot of service leaders over the past months about their experiences in the centres and what really helps them, have impact and what blocks them have impact. Can you share with us some of the kind of key findings from the discussion paper on what really enables these centres to thrive and have the best impact for kids and families?
I do have a lot of information. So I've spoken to about 20 service leaders, sector leaders, government people working on this. And interestingly, I think a lot of the enablers are consistent across all the models and all the different centres. So I think the first, I've got four main ones I'm going to speak to. The first one that came through so strongly was the importance of leadership and centre leaders and the workforce. These centres are absolutely dependent on excellent leadership within each centre. And I think the thing that came through so strongly in the interviews is this is a really complex job. It is, apart from leading a centre, which is already dealing with families and children who have incredibly complex needs, they're also leading a multidisciplinary team. And I think the challenge of that is really hard to get your head around, that you've got all these different people who have different backgrounds and sort of see themselves as the expert in their field. And you've got to get them to work together collaboratively with shared goals and vision for the children that you're supporting. On top of that, for a lot of these centres, they are essentially running a business without much support behind them. They're doing the grant seeking, writing the reports on, how the funding's being spent. It is a huge operation, what they're doing. So I think it goes without saying that these centre leaders and their workforce need to be remunerated properly. They need the professional supports in place to ensure that we keep them there and that they are supported to lead these centres. The second enabler and barrier that comes up again and again is funding. And there are so many challenges that come up with funding, but I think it's a really good point to pause and recognise how different the Aboriginal and Torres Strait Islander integrated early year centres are in their model in providing this incredibly sophisticated output and yet having such huge challenges in terms of funding. They, for the most part, are funded through the childcare subsidy, which I think, research demonstrates is a really inappropriate funding mechanism for an integrated centre. And they are scrambling to find grants to keep them going, to provide that fully integrated support service. So I think the funding is really, really acute for the Aboriginal and Torres Strait Islander centres. And it goes without saying that they require a unique funding model designed to support them and the unique needs that they have. More broadly, there's funding challenges across the board, and I think some of the jurisdictional challenges create huge barriers. In mainstream centres, there's a lot of them that are state-run and owned, struggle to provide childcare, for example, because that's funded through the federal government. Really little things like that really impede on them being able to provide a full range of services because of challenges with jurisdictional funding arrangements. And then, as Cassy spoke to, just the need for funding to be flexible, that centres can have autonomy with how they spend their money so that they can design programs and supports that are reflective of the needs of their community. In terms of funding as well, there's a big piece around the integration, or what we're calling the glue, and they are the structures, the IT, the staff, the supports that provide that integration component. They are what wraps it all together and brings it together to provide something that is more than a sum of its parts. And that needs to be recognised and funded adequately so that these centres can keep delivering such a holistic model. Then I think the two other enablers I'd say that are so key is quality. And I think, everyone knows that quality is so important, and especially when you're working with children and families who have experiencing disadvantage and vulnerability. And yet, outside of formal childcare and preschool, there is no way to consistently measure quality across these centres. There's no frameworks, there's no processes, and that is so challenging for centres to know, am I doing the right thing? Am I having the best outcomes? There's a need for data collection to be good, data analysis to be good. So quality is a really big one. And then finally, I think a really interesting thing that came out is allied health. And there is a huge gap in allied health provision. And every single person that I spoke to said that allied health is critical for early intervention, critical for children. And yet there's no systematic way that these centres can guarantee access to allied health. And you have some, so some of the Our Place sites have been incredible at getting allied health provision on their site, which is incredible. And, in Queensland, you obviously have, partnerships with Queensland Health to get some funding for it. But even then, we have this huge workforce shortfall of allied health practitioners. And all of the centres talk about the inability for them to get therapeutic supports for children. Even if they can get allied health on staff, it'll be doing capability building, which is incredible. But getting one-to-one support for children is really, really challenging.
Fascinating. Thank you. So we've got supporting leadership, funding, quality, and allied health for K1. Cassy, how does that resonate with you, and what do you see in your services as having kind of that most impact on seeing you have the outcomes you want to see?
Funding is definitely the main one. Just working with other services who have very strict KPIs and things like that, I can see how much they struggle. Leadership, I think I was talking to Caitlin earlier today, leadership's really important in that you need to know that you're not going to be sitting at your desk crunching numbers, trying to figure things out. Like, you need to be out in the community, building partnerships, building relationships, talking to families, and then going into the playgroups and having chats with families. So it's much broader than just doing the admin, basically. I can touch on all of them. The allied health is very important as well. And I guess coming back to that transdisciplinary team, I'm very grateful for the team that I have, because I have a lot of like-minded individuals who wanted to come together to work in a different space. But it has been difficult in the past trying to, at least for our brokered services, get allied health practitioners on board who are willing and interested in working in that universal space. So not necessarily offering one-on-one interventions and therapeutic interventions to children, but doing it within that universal space within the playgroup, building capacity and capability in parents. We have thankfully been able to find people who have that passion, but I know that that's a struggle for some of the other centres that we've worked with as well. But yeah, partnerships I think are key, and probably where you don't have that holistic funding, I think that's where you can kind of pick up some of that support. Definitely is how it is in Cairns anyway. So yeah,
Mindset piece you talk about is so critical. It seems like coming together from different disciplines and relationship-based practice to really collaborate and work together. It's such a different way of working, right, from the previous siloed sort of approaches.
They definitely have to understand the mission.
Yeah.
Yeah.
Now, Lachlan, you have just finished a pretty significant piece of work. Can you start with sort of talking us through what are sort of the development and wellbeing needs for children across Australia that you've been unearthing? What did you map? How did you map it? What's the extent? What does it tell us?
Yeah, of course, amazing. Excuse me. Thank you, Emma. And yeah, I just wanted to start by saying what an amazing privilege it's been for us to do this work. I mean, we, Deloitte Access Economics, the education policy team here, we do a lot of work in and around this realm, but I think to be able to work with social ventures, to be able to work with CCCH, I mean, you can hear the knowledge that Caitlin has, you can hear the knowledge that Emma has. Of course, working with, Tim is an incredible privilege. And so to be a part of that has been a really wonderful thing for us, and to get access to, frontline stories such as the ones we've heard from Cassy, not just today, but through the course of this work has been, a really wonderful thing for us. So we've really relished the opportunity and really grateful to have done the research. I think what's tough about our task is taking some of what we've heard, some of the, the theory and the principles and the research that Tim's taken us through, some of the frontline stories that we've heard from Caitlin and Cassy, and then we've tried to translate that into some numbers. It's a bit of an unenviable task in a sense, because, we're trying to say, well, how do we define need? Who would benefit most from these services? Well, the reality is everyone would benefit from greater access to services and to greater integration and to access to an ICFC. And so it's a bit of a challenge to work through and then say, well, we need to make this a bit tangible, and we need to get some numbers around this exercise, because some of the decisions that we might like to see made rely on having numbers. So we've taken on this unenviable task, and we've gone through a bit of a process of saying, well, how do you take some of these things that we've heard about and then get some measures in the data that exists? And we need some measures that can be applied nationally, some measures that can be applied at a fairly local level, because we want to understand, communities, not just a bigger sort of macro story. And so we hone in on measures that can be quantified at the level that we use as the SA2 level for the purposes of sort of thinking about a community here. And then we say, well, of the data that exists, what helps us to gauge need or to think about the communities and families who benefit most from an ICFC? And we start by looking at a couple of broad population measures that most of you would be familiar with. One comes out of the AEDC and the other comes out of the CEFA data. So with CEFA, we sort of have this kind of broad socioeconomic measure of disadvantage. In AEDC, we're looking at children's development. And I think when we put those two things together, and noting really that there's a spectrum here, and you could set the thresholds at a variety of different places, but for the purpose of getting some sense of this, we have to make some calls. And so we sort of look to convention in where we set them, and with AEDC, we look at those areas where 10% of children are developmentally vulnerable on 2 or more domains, and with CEFA, we look at the 4 lowest deciles. We put those two things together, and what do we get? We get a list of about 706 communities across Australia. These are statistical area 2 SA2s, of which there are about 2,400 across the country. So it means that on this initial list, there's about 30% of the communities across the nation who we think would benefit from a service of this nature. We know some of them have services already. I think Caitlin quoted that figure of around 200. About 105 of those are in these communities. So we know there's some service provision already, which is a help to us. In terms of where we see those communities, we see them across all jurisdictions. And if we look to, it's a sort of a ranking exercise. So we get not just a list, but we get some sense of the communities who would benefit most, given these characteristics of interest to us. And we see within the top 50, all jurisdictions except the ACT. And there are reasons why CEPA may not be the best measure in the ACT. But what we know is that it's quite widely spread. But we do know that it's very highly represented, these high needs areas, these areas that would benefit most from an ICFC. We see them predominantly in regional and remote areas. We see a lot of them in the Northern Territory. We see a lot of them in areas that have a high concentration of Indigenous population. Interestingly, we also see quite a few of them in metropolitan areas that are sort of high growth, on the fringe of the bigger cities, in areas that have been recently urbanised and are developing. So it's quite a broad-based story, many areas that you'd be familiar with and that you would expect given the other work that's been in this area. The next step in this exercise of getting some sense of the challenge or the opportunity or what the policy response could look like is to say, well, what proportion of families in these communities do we think are those who would benefit most? Again, this is not a straightforward exercise, and again, conceivably all families in these communities would benefit from greater access to an ICF. But for this, we look to measures like household income, we look to employment status, we look to things like social housing. We look to the census data for this. So this is about understanding the families within these communities of interest and to say, okay, well, given where we know the benefits could be greatest and the need is greatest, what proportion of families do we see in that category in each of these areas? And across those communities, those SA2s, the 706 that I spoke about, we see a bit over 100,000 children in the 0 to 6 age bracket who meet that criteria. So 106,000 children, around 17% of the children in these communities. Again, there are no doubt children outside of that group who would benefit from greater access to an ICFC, but for the purposes of understanding those who benefit most, those are the type of figures that we work with. There are, of course, children and families outside of those areas who would benefit from being able to engage with and access an ICFC. So it's not to say that this is the limits, but for the purpose of getting some sense of the overall need, these are the sort of numbers that we're working to. And it's about 5% of all children in that age cohort nationally. Again, noting that there would be children outside those communities of interest that we have identified.
Thanks, Lachlan. And I think that for me, that sort of look at that approach really takes us back to, Australia. In Australia, we have really high concentrated poverty in certain particular areas. And so this really builds on that. We have children who are struggling, within families who are struggling, within communities that are struggling, and see the ICFCs as really a place-based response, as Tim said, really needs to be driven by community. And so it really fits with that sort of lens of where we can see most bang for our buck, I guess, sort of families that could most impact. Now, what surprised you? Did anything surprise you in doing that process?
In terms of the regions that it uncovered?
Well, yeah, and the numbers and the extent and where, anything that you found unexpected?
I mean, there's a lot of work that's done around measuring need, and so in that sense, a lot of the areas that we see come up high on these lists are the areas that are on many lists of this nature. I think that the sort of growth areas in urban metropolitan areas was a little bit of surprise to me. I think it's quick to go to remote areas, and we know that the territory is going to be well represented, and we know, and many people would have joined the webinar that Snake ran earlier today. We know the challenges facing Indigenous children and communities in terms of their development outcomes. So it wasn't a surprise to see those regions on this list, but it certainly was a surprise, I think, to see some of those fast growing urban areas. I think when you look at the current provision, I mean, the fact that we have around 100 of these 700 communities that have an existing service, it suggests that there's a very big gap there, a surprisingly large gap, I think, and so that probably wasn't fully appreciated. And yes, there are other models, there are hubs, there are other forms of place-based models, and so this is not exclusive as far as the integrated services or the services that these families can access, but as far as this ICFC construct, I think that was a bit of a reality, seeing the extent of that coverage and just seeing the size of the gap.
Yeah, and there is a very big gap in terms of that provision that Caitlin spoke about, and 200 services and then 100,000 children, really significant need. What are your thoughts about how we best progress to going from this reality to seeing, majority of those kids accessing?
I'm very, very cold up here to now very, very warm all of a sudden. I think I was motioning to get the aircon down, and it's now warmed up a little bit. Look, I mean, I think there's been quite a few comments, I think, already in the session about what a great opportunity we have, and I think we do have a great opportunity. I mean, having worked in the sector for quite a period of time, I can't recall a period where there was as much energy and aspiration towards the future as there is now. We've seen it in big policy announcements by some of the states. Got the Royal Commission work in South Australia. There are a number of things afoot at the federal government level as well. And you've heard Tim talk about, once in a generation, and you heard it in Susie's comments as well. And so, I think there's a really big opportunity now as part of this discussion and dialogue and push that is taking place to get these services onto a stronger footing. I think getting them onto a stronger footing does require, a stronger national vision for ICFCs. Now, you heard from Caitlin about the wonderful models that exist now. There's so much good work that's being done already, and so many states in particular who are so committed and have been investing recently. And we've seen, quite new announcements like, say, Brighter Beginnings in New South Wales, and even nationally, things like Connected Beginnings. So yes, there's a lot of energy, there's lots of good stories, and including at the coalface level, but there's not a clear national vision for the role that these services could play in the future. We're talking about a new early years strategy, and this needs to be a really central part of it. And I think, you look at those numbers that I've just made my way through, and the reality is that sort of planning is really key, and prioritisation is really key. And so that's where having that vision and then having a framework and a basis for planning and decision making connected to it is really, really key. I think, you can't move past funding, and obviously funding was a big part of the work that we did, and you hear it in every single one of these discussions you have. And it's not just the same story that you would hear about funding. If you go and ask most people, would they like more funding? Yes, certainly they would. But it's not so much about more funding, it's about the conditions under which funding is provided. And, you heard Tim talk, you've heard Caitlin talk, you've heard Cassy, and you hear about what they're doing. And the challenge for funding is to say, well, how do we support and enable that? They're doing wonderful things. And so what do they need in a funding model or environment, and how is that different to what we have now? And so you need, flexibility and certainty. You need confidence in the future. You need responsiveness. We know that circumstances change. We know that families' needs change. And so there's quite a bit that needs to happen there. And, you see in our paper some elements of that vision as we sort of set it out. I think ultimately, a big part of what these services do isn't really funded in a systematic way. And that goes to this kind of glue construct that you've heard people speak about. And this is the core of the sort of the driver of the benefits here. The service provision is so key, but the curated experience for families, the ability to link them in and connect them and to create this welcoming environment, to take everything that Tim's just stepped through, like that's what you fundamentally need, is that. And so I think our report focuses on the early phases, yes, planning, that establishment process, co-design, participatory approaches. Then once service is operational, it focuses on the maintenance. That's just historically not been well funded. And critically, it focuses on this glue or in this integration element. Yes, having access to funding for services is very, very key. But if you don't have funding for that core function, that core role, that core underpinning of the services, then the benefits that they can potentially realise just can't be achieved.
Now, we did give you the unenviable task of numbers.
You go to this.
Give us a sense of kind of how would you start? What does kind of some kind of scale look like, and what does it mean?
It's one of those tricky things to try and get. It's hard enough to get a sense of what the overall level of need is, or the families who could benefit most, and you feel like you're doing a bit of a disjustice to the concept in trying to do that. But nevertheless, there is a need to, and so we've looked at some different scenarios in our report. You'll see those there, and there's sort of steps towards a future. I mean, conceivably, you could look at all of these 700 communities. There's 600 of them that don't currently have an ICFC, and you could have a vision and a plan to ensure all of them do. And you could think about the costs of that and price that. I think the steps that you see in our report are a little back from that. They say, okay, well, let's be reasonable in what might be achievable over the period ahead. And for the first of those, and for the number that I'll just quote a couple of figures on now, we look at the prospect of 300 new centres. We think the sort of upfront costs of that would be around 1.3 billion, and the ongoing costs around 292 million per year. in looking at the ongoing costs, we've looked simply at the sort of the glue, this sort of core function, as well as the maintenance aspects, because really they're the things that aren't systematically funded at the moment, and they're the things that are key to the future of this type of model. Now, what do those figures mean? I mean, what is 292 million a year? They're pretty large and abstract figures. They're modest relative to $10 billion a year on the childcare subsidy, but they're not negligible. But the reality is we do know there are a lot of benefits. The return on investment to these early years, high quality early years programs is so high. We also know there are efficiencies to be gained in the sort of the better utilisation of existing spend and existing services. So I know those figures are a little abstract, but I think fundamentally they point to an investment with a high return, and I think an investment that has a really strong backing behind it. That figure, that 300 new centres, would see about 50% of the 700 communities have at least one ICFC, and 24,000 of those 100,000 children, so around a quarter of them, access an ICFC or have access to. So, it's modest. The challenge is a lot bigger than that, but it would be a significant first step.
Thanks, Lachlan. So it's very thorough, very complex, and we do have a brief that helps break it all down.
Emma had to sort of rewrite our report into a brief format to make sure it was digestible for people.
We're not good at pithy. That's definitely not our skill. Not a pithy group. Anyway, Cassy, so I'm curious to hear kind of what resonates for you in that 300 centres, the diversity of areas we're talking about, complex urban settings, very remote. Australia is very diverse. We're kind of talking about a flexible but one kind of model. So how does that sit with you, and what are some of the thoughts you think we need to be thinking about and planning about across, Queensland, for instance?
I guess in the Queensland context, especially far north Queensland, we have a lot of discrete Aboriginal communities up in the Cape and Torres Strait as well. I can't speak as an expert for them. I have had experience working in those communities and with the wonderful people that live there. And I think, and even as Cairns is a regional city, we still suffer from the problem of people in the big cities and the big metropolitan centres trying to duplicate and cookie cutter programs that work in their settings and put them into the other communities. So I think it really needs to be community driven, especially in those remote communities. There are people there who have skills and abilities and strengths, so they're just not untouched is the wrong word, but yeah, that are just not utilised appropriately. And I think being able to upskill those people in the communities, like seeing what's already there and then how you can build on what's already there, is really important, rather than trying to bring everything in from the outside. I mean, fly in, fly out, telehealth, they're all great and they plug a hole, but it's not actually getting to the root of the problems. So I think that's really essential in listening to those families, listening to those voices.
Awesome. Yeah, thank you. So some really critical principles there, sort of community driven, building on what's there. Certainly I'd add sort of self-determination and Aboriginal Torres Strait Islander led for a lot of those communities as well. Caitlin, what do you think coming out of that are the key asks that you see are critical for government? Like, where is there a state role? Is it state role to step up? Is it feds to step up? I'm just going to throw you in it here.
Look, I think the state's doing an incredible job at rolling out these centres and implementing these centres across Australia. And I think their contribution has to be really recognised. They are absolutely the powerhouses behind what we've got on the ground at the moment. Having said that, no state can provide a national lens. That's not their job. That's not what they do, and that's not what they're funded to do. So we need the federal government to step up and provide this sort of connection against this sort of patchwork landscape that we have, and look at how we can raise consistency and standards, quality frameworks. And we need funding that can provide consistency in terms of especially that glue function. That sort of recognises that we need all of these centres to be empowered to provide a fully integrated offering, and that needs to be well funded. So I think there's a huge role for the federal government to be involved in this space, and then obviously for the states that don't have models currently or who are looking to build new centres anyway, to consider if new centres could be integrated centres, because there's a lot of movement on the ground at the moment, especially in Victoria and New South Wales, to build new centres. So let's see if we could make them integrated centres and do it while it's all happening anyway. Yeah.
Now I've got a really interesting question that's come through on the chat, which is, how do we break down the silos between health and education and between state and federal funding? That's a good one. Who wants to take that? Do you want to kick off, Caitlin, and pass it around?
I think it's a great question and it's a huge issue. One thing that we have sort of spoken about is this mystical idea of pooled funding. And I guess that goes to say, especially with the health and the education at a state level, let's provide funding for an integrated child and family centre, not funding for the early years stream of that and the health stream of that and the allied health stream of that, to say this is a bucket of funding that recognises the breadth of what this model is. And if you need a lead department to lead that, fine. But that funding that's being pulled in needs to happen at a higher level. So it's not the centre's responsibility to be navigating these different funding streams and trying to deliver all these services. So I think that is a big one and a big opportunity for states to consider how they could pool funding and pool responsibility for it, to sort of say education's in charge of this centre, and that means that everyone working in that centre will answer up in terms of our, KPIs or how we're structured, and that might mean that health has to let go of some, bits of accountability or not, control, and we're going to subsume this into the one model, and we're all working for the one vision and the one goal. I imagine that's challenging to implement, but I think that's kind of what needs to happen. And then the state and federal issue. I mean, I think in reality there needs to be some sort of national partnership. There needs to be agreements that work together that really sort of say, again, the outcomes we're trying to achieve for children and families are the most important, and we're going to work together to make that happen. And whatever needs to happen to allow these centres to be able to do that, we're going to make it happen. And that means, data sharing seems to be a huge one. We're going to allow that to happen, and we're going to sort of bring down some of those boundaries, recognizing this is the mission and the vision of these centres, and partnerships have to happen to allow that to happen.
Anyone else want to jump on that one?
I can add to that.
Yeah,
I guess
great.
in Queensland Health and Department of Education do have an overarching MOU. So I said partnership with Queensland. We do have the partnership as well, but it is governed by that overarching MOU where it does talk about data sharing. And I think originally when they did do the funding, it was Queensland Health was also involved in that.
So it's possible.
It is possible, yeah. And then
the
local hospital and health services then make the partnerships with us on the ground on what that model looks like on the ground.
Amazing, thank you. Lachlan, do you want to jump in on there, or should I go to the next one?
Well, happy to be going third on it, and I won't take up too much time. I mean, I think there are some good examples across the states. It's been challenging, and I think the imperative is to just stay the course on those, improve those concepts, and try and push forward. I think particularly during COVID, I guess reflecting on experiences here in Victoria, we saw some really innovative models in the way departments work together. They just had to come together. They had to share information. They had to bring resources together, and actually it was quite remarkable some of the things that were achieved out of that necessity over that period. So we know all the reasons why it's tricky, but we're getting some nice proof points and some nice evidence of the successes, and so I think we just have to push on with that. I think sort of on the Commonwealth state side of things, I think just not missing the opportunity that exists now is the main thing that I would say. You can see the appetite from the states, not just to invest in their legacy areas, preschool, kindergarten, but to invest in centre-based daycare programs, and to invest in outside school hours care programs in a number of ways that actually start to shift those classic roles as far as the states and the Commonwealth are concerned, and where we're in the process of developing a new national strategy. So let's not miss the chance to do some rethinking around that. I mean, Caitlin's right. A national partnership would be fantastic, but they have their challenges, and history is a bit mixed as far as the degree to which it's supported these aspirations. And what's better than a national partnership is something more fundamental than that as far as the role of the states and the Commonwealth is concerned, and a breaking down of silos through that mechanism.
Now, while you've got the mic, getting practical here. So if whether it's sort of 300 services we want or 600 services to make sure that 100,000 kids get access, practically, what is that going to take? Politically, what's that going to take to implement such a large-scale endeavour? What are some of the things we need to think about?
Just acknowledging, I don't think the practical side is my greatest strength. I'm happy to share a few reflections. I mean, I think, we've spoken about the infrastructure need, and there is some wonderful existing infrastructure that we could make greater use of, but no matter how you look at it, there's a need for new and additional infrastructure, purpose built. You've heard about the principles. We've put some numbers around what that could conceivably look like, so that's really key. I think, you can't have this discussion without talking about workforce, and I think with talking about workforce, you just want to find, in my view, a nice middle ground on this. Like, yes, we know it's very challenging, particularly for the workforce that we're talking about here, but we can't let those challenges prevent us from moving forward. We need to be respectful of them and have good strategies to address them. But I think, in a few conversations now, you sort of hear some sense of resignation about the scale of the workforce challenge, such that we sort of can't push on to pursue important things like this. But we need to be able to. But equally, quality, you heard Caitlin's point, leadership, the quality of the workforce is everything. And so that's, obviously, one of the really fundamental domains. I think I spoke about the policy side of things and a clear vision, a national framework. It's wonderful, all of the success stories that you hear at a state level, at an individual provider level, at an individual service level, but they're not systematic, and they're not systematic because you don't have a national model or a national structure. And so, I think that's one key thing. Politically, well, I mean, getting into trickier territory again, but I think it's just about, the appetite, and there is a lot of appetite today. And, hearing the Minister on the earlier session today, including touching on points related to integrated service delivery, I think there is really a different tone to those conversations and a real willingness and appetite. Now, it doesn't mean there aren't barriers and challenges, and where will the funds come from, and how do the states feel about it, and who's willing to give up what? Like, there's all of that argy-bargy to work through, but I feel like there's a greater level of political will than there has been in the past. And I think we're going to go to a federal budget coming up. We've got a strategy under development, and so I think there's lots of sort of planks and levers there that could support this.
Thank you. It's very hopeful. I like that. It's a good time to be hopeful and to put that hope into some action. Now, Suzie Honeysett, can we grab you up here, please? This is the fabulous coordinator of the National Child and Family Hubs Network. Suzie, can you talk to us about, share what are your reflections from hearing this? How does it align with the other hubs? What is the network?
Sure. Thanks, Emma, and thanks for having me here today. And I just wanted to start by saying congratulations on the pieces of work that have come out today, which are really fabulous in the richness and the detail that provide ongoing guidance and learning from us, not only for integrated child and family hubs, but all hubs really. And that's what I wanted to just mention briefly today. Emma mentioned that I'm managing the National Child and Family Hubs Network. This is a bringing together of a range of front doors for families to be able to enter in through. And integrated child and family centres are one of those front doors, but we're also bringing together hubs from primary schools, primary care, primary health care, Aboriginal community controlled health organisations, and other non-government community-based hubs as well. So across Australia, and this is based on the work that SVA and CCCH have done, we know that there's over 460 hubs available for families, with this front door that's open and welcoming, that they can come in and provide social and service support for families. So I think that suite of support for families, if we look at hubs more broadly, is really fabulous. But this work that we're talking about today has really, I suppose, brought similar issues, I think, that are happening across those other front doors, whether it be primary schools or primary healthcare, to the forefront around funding, around leadership, around quality, around some level of national framework, which is really important. And because it's not there at the moment, there has been this opportunity for the national network to step into that space and really bring a lot of these organisations, and there's over 20 that are sitting around the table on the national network, and others who are actively involved outside of that, together to think about how we might do this in a national sense. SVA and obviously CCCH and Murdoch are key partners in this, as well as many other organisations such as the Benevolent Society. So we've got really key people well as philanthropy and state and national government sitting at the table there. So we're really hopeful, and I think you're absolutely right, Lachlan. Where we should be optimistic. There's a lot to be optimistic around from not only a policy perspective, but the existing capacity that we have and appetite for hubs. And I talk of them as hubs. You know, there's lots of different terms, but child and family hubs, I think, is a term that we've used in a broader sense to encapsulate all of those platforms that we're talking about, or front doors, which are really important. I could probably go on forever, but that's probably enough for me for the moment. Thank you, Emma. Thanks for the opportunity.
Thank you so much, Suzie. It is really exciting to see lots of the different hubs come together and start to learn about what are some of the differences and similarities and how we build the field. I think that's why I'm also more hopeful, I think, about the kind of scale we're looking at, because we're not starting from scratch. There is lots of amazing services out there, lots of different forms of informal and formal hubs or integration. It's really about how do we build on the strengths of that, identify what are the core components for impact, and make sure that all of those services from the community are kind of funded and supported to have the impact that meets their vision. Now we are at question time. Does anyone have in the audience? I'm going to go straight to those in the flesh here in front of me. Yes. Would you like to come up and ask a question, or is it okay if she does it from there? Shall I bring this?
I can probably just speak.
No one on the online will hear you. So.
Thanks very much. I'm Annabelle Brown from the Centre for Policy Development. Hi everyone. Thanks very much. It's great to listen to you. One of the things that we've found when looking at place-based and more people-centred responses like these integrated hubs is that they, in what is an incredibly fragmented service system around early childhood development, they often they pop up. They're funded quite unsustainably. They sit to the side of the major service systems, and that's where they sort of grow and then quietly fall away because they're superseded by something else that comes into the comes into view or into favour. So I'm wondering about, and I'm hearing, and of course really aware of the policy landscape at the moment and the great opportunity. I'm wondering, what did you find, if anything, about how these sorts of approaches can be better integrated with the big service systems that already exist, so they're actually working towards supporting this rather than at odds with it?
Great question. Awesome. Who would like to take that? You did go first last time. I'm happy. Yeah. Okay.
I guess from a practical sense on the ground, we often struggle because we're called an early years centre, so we're often thought of as a daycare. So I am consistently with the same people as well, over and over again, having to talk about what we're doing and making sure we're part of everything that the rest of the service sector is a part of. And I don't think Cairns is much different from anywhere else, that the bigger players in the service system, like child safety for Queensland, that's the Child Protection Service, health, education, they're always scrambling to look for people to refer to. So I think it's up to the services really making sure that they put themselves out there and make sure that their name is out there and that people know what they do and what they have on offer, because I'm forever having to go and do team meetings with other services to let people know, and there's always the light bulbs. Oh, I didn't realise you guys did that. I just thought you were a daycare. So for us, it's also the name. We need to not be called an early years centre, but you know, it's what we do. So I think, yeah, it does come down to the services themselves, really making sure that they put themselves out there in the community and not just sitting back and hoping people come to them.
And for me, that comes back again to that glue funding, right? To be able to be funded for that role.
Yeah, exactly.
As well is so important. And Lachlan, I wonder, for me, that question connected to some of the funding options that you've looked at that were kind of more ambitious, that sort of brought together the states and the feds. Do you want to talk us through one of those that you think would help better integrate ICFCs within the broader early childhood development systems?
Yeah, definitely. And I think Yeah, I think I was just going to refer back to a quote of Tim's earlier, and I know he's had to drop off the call now, but I think he spoke about re-envisioning the entire early years system, and there's always challenges on the degree to which you can do that. But we have a strategy of a PC review, we have the ACCC review at the moment, and you look at the terms of reference of the Productivity Commission review and Deborah Brennan at the helm there, and the prospect of a 90% CCS, and looking again at ACCCS and the activity test. And so there are some fundamental things that could conceivably come out of those processes that could quite drastically change the landscape and the degree to which there is a basis for something that is a little bit off to the side and a bit fragmented now to have a more sort of formal and established and systematic place in the system. Yeah, in terms of options going forward, I guess we have tried to position the possibilities around this sort of fluid policy environment that exists currently. And so we know the principles that we're striving for in terms of certainty and responsiveness and flexibility and sustainability. And we know the elements that are not well funded now, and they've been spoken about a few times, but especially this glue function. And so we think, okay, well, how could we think about a world in which those things are systematically funded? Clearly, the federal government is the government with the greatest fiscal capacity, and so I think we contemplate scenarios where, as part of a national model and structure, they take the leadership in terms of systematically funding and recognising and putting a national policy framework around these services that gives them the status that they don't necessarily have currently. Equally, we entertain other possibilities where the energy that we're seeing from a New South Wales, a Victoria, a South Australia with the Royal Commission, and absolute respect to the wonderful work in all other jurisdictions as well, that could be more of the catalyst. And so there are some possibilities where the states take on a little bit more of that responsibility. I think our view is that if it's going to be a national model, and if it is going to really take us to that next level and realise the opportunity, then it should be, federally led, both the fiscal capacity, but the sort of national consistency to it. We can have all the other elements that we love in terms of place-based and participatory and co-design, and the states so central in service delivery, but we think that would be the preferred model, but noting that there's just more than ever a lot up in the air in the current policy landscape.
Thanks, Lachlan. Now we have another question online around integration and whether all services need to be co-located within centres and what an integrated system could look like. I'm going to give one of you a chance to respond, and then we might, given Tim's gone, we have his esteemed colleagues from the floor who may want to come up and chat to us about an integrated system. What is integration beyond co-location, and how we can facilitate a more virtual approach as well? Does anyone want to talk to that here?
I can try. I guess for us, integration, Benevolent Society as a whole is going through a process of integration because we have the disability, child, youth and family and ageing stream. So there's that whole process of bringing people together to understand that better. But yeah, co-location, I find with us, with having the child health nurses as well as Witch Hopper, and having them actually be part of the team doing your work is really important. I think that for our centre specifically, I know that other centres who are set up maybe a little bit differently, it might be different, but I think definitely working as one team, it really helps to make that integration. We don't work as separate team. Like Queensland Health obviously have their own policies and Witch Hopper and themselves as well, but the work, we all come together around the work. The work that we do is the same. So that's kind of how we integrate, if that makes sense. Yeah.
So integrated practice frameworks.
Yes.
Rather than just co-location.
Yeah. And we're all aware of each other's practice frameworks. So the Witch Hopper and staff actually work under our practice framework, and Queensland Health come to the trainings to learn about our practice framework. So there's actually, we share that. So that, and we develop policies on how we co-work cases. So if a child health nurse is, involved, how do we co-case manage that with a child health nurse, and who's going to do what and when? Yeah.
Great. Yeah. Thank you. That's super clear. Would you like to share some thoughts, Lauren? Thanks. Yeah.
I think that essentially you don't need necessarily to have all services co-located in order to provide an integrated response. But I think if I if I'm standing in for Tim, I think, and I hear his voice, I think what I would say is that what co-location enables is the provision of a place and a physical space that families can identify as a community and a comfortable a space that is for them and that they can walk into and they don't need an appointment for and they don't need authority or permission to be in. And that is one of the definite benefits we're talking about here with ICFCs. It's not just about services working together, it's about a space that families can identify as for them so that they can connect, so that they can get peer support. And without at least some form of co-location, you won't have place, I suppose, would be my thinking. Yeah.
Beautiful. Lauren Heary, everyone. Did Tim proud. Any other questions from the audience here? Yeah. I grab it.
Lauren might be the right person to answer my question as well. Debbie Williams from Toy Libraries Australia. We were really excited. I was really excited to hear Tim talk about the social hub, not just the service hub. And Lauren started to touch on it just then. I'd be interested to hear the panel talk more about what's needed for that social aspect of the hub for it to really work. Because as toy libraries, we're either not invited into the space or we're invited in at the last minute when it hasn't considered our needs in the development process.
Such an critical part, I think, that social hub component. Caitlin, do you want to kick off?
Yeah, thanks for the question. And it's a key one that came up, and thank goodness for Tim to continuously bring us back to that when you start to use the word service too often. From my understanding and talking to centre leaders, that is where the magic happens. And they all, again, talk about it is far less about, and then we referred them to do this program. It is, I sat with them and I had a cup of tea. And there were toys there for the kids to play with and a playground, and that's where the conversations happen, and that's where they are able to start, working with families, building trust, identifying issues and whatnot. So it's been interesting, Tasmania puts, when we've talked to them, a huge focus on that social space and the architecture and how it's designed, and the full design brief incorporates that social space to be front and center of the model, and it's incredible. And I think that is something that is so crucial and goes back to that point of co-location, and the point that really differentiates these models currently from, say, a long day care centre or whatnot is that open space. Families are welcome to come in. So yeah, I think it is a massive one, and I think it goes to, quite, on a practical level, the architecture, the design brief, all of that. But then it's also supporting staff to have that flexible time, that they're not always scheduled in programs and service delivery, that they actually have time to just be with families, to welcome families, to make families feel safe, and to be able to sort of also identify what is the community needing. Is that a toy library? What is not here that these families need and these children need? So I think the funding really needs to speak to that flexibility for staff to be able to decide and work with families outside of service provision.
Can you talk just briefly about the kind of integration glue funding and that component we're talking about and how that enables social hub?
Yeah, so that I think is the magic sauce. I'm using terrible analogies at the moment, so the glue, kind of as we've defined it, is this sort of broad set of services, systems, people, administration, IT, that brings all of that together, that allows that sort of broader space to happen and recognizes that social element. And that is the stuff that you can't fund through service delivery as it currently stands. It can't be funded through maternal and child health or childcare subsidy or whatnot. It is the informal supports, as it's terribly called. And so that's the stuff that needs to be built in there, and that is the additional staff time and the space and the systems that allow people to work in that integrated way. Even just the data sharing, which I think always sounds, quite high level, but that one practitioner can say to another practitioner, hey, this family's having X, Y, and Z going on. let's work together on this. That requires permission to be able to share that information and work together in that way that to a family seems like a casual conversation, but actually, you know, there's a lot happening in the background. So I think for centres to have that funding would really enable them to be able to deliver more of that. And knowing that a lot of centres are doing that anyway, you know, out of their own back, and to be funded to do it properly and have the structures in place that enable that is a really, really key enabler to have more of these integrated centres.
Thanks, Caitlin. Cassy, I'd be keen on your reflections on that from practice perspective, what really enables that sort of social hub. And
Yeah, aside from the space, like we're very grateful to have 2 purpose-built centres that have like great spaces to be able to offer families. But I think it also comes down to staff's ability to build relationships. I think that's really key, and having a consistent model of which you work and a shared understanding within the team about that relationships are the most important part of our work. So the way we structure our supported playgroups is we ensure we have enough staff to be able to have those individual conversations with families. So if we have 40 families attending on one day with 3 staff, those staff are making sure they're getting around to every parent and having that conversation, and then linking them with other parents who maybe have a similar, you know, child the same age and things like that, like being that kind of, I say, the glue within the centre to kind of bring people together as well. And I guess for us too, like even just things that might not seem important, but are like just having a Facebook page that people can, and being responsive on that page so that people actually feel like they're part of a community. And even when we're communicating, because it's the Cairns Earlier Centre, we say, you know, this, welcome to the CYC family, like you're here, you're part of this now. So I think relationship is key, and culture, exactly.
Yeah, really powerful.
Yeah.
Now, while you've got it, we've got maybe 1 more minute or so. A really tricky question that's come through. How do we create an integrated service system while working within a system that's not?
I always come back to that, yeah, thinking of the big picture is important, and it's a daily frustration, especially at a managerial level in an operational setting. But on the ground, you can do what you need to do. I would always say to people, like, even if you feel like you are restricted with your funding, look at what you can do. Speak to your contract managers, ask them, like, can I do this? Can I do that? Seek the partnerships. If you can't do it, perhaps giving the idea, not making it be about a competition, and seeing if somebody else can take that idea. If you have the mindset that it's for the community, then I think that you can always integrate and you can always do it on the ground regardless of the broader system.
Yeah. Yes, I'm again hearing that culture,
Yes.
right?
Yeah.
How do you create that culture for collaboration,
Yeah.
integration among the service sector?
Yeah.
Anyone else want to weigh in on that? 10 seconds.
Just my final add on that
Told you she had a lot to say.
would be, if you're going to do nothing else to make it easier to integrate at the top, support the centre leaders, because they are the glue and they are the ones that enable integration and drive that culture and get the work done on the ground with the community. So if nothing else is going to change above, let's make sure centre leaders are supported and remunerated and funded and have what they need to be able to do the best they can in the circumstances they find themselves.
Fabulous. Now, thank you so much to our beautiful panel. I've been really humbled by your passion and commitment and insights today. Thank you so much for your time. I'll pass back to our CEO and leader, Suzie Riddell, to close.
Thank you so much to everybody who has shared, including the people who were voluntold to share as well. I just have this really vivid image now from what you have shared of kind of walking in to one of these spaces which is friendly and warm, and it's clear that it's for people like me. And if I'm the parent, I'm not worried that there might be a wee accident in a weird place. If I'm the kid, I know that this is a source of joy, and that I'm not going to get in trouble for breaking things, and that it's a space outside of a private home, which is for us. And that when you kind of imagine that freeze frame in the movie with the spotlight on the child, that you can then go, that child feels safe and belongs because somebody is crazy about them. I loved that. And then you zoom it out and that parent has someone who's crazy about them and they feel safe and loved and that they belong. Like that, I think you all did, including Tim, a brilliant job of bringing that to life and making that feel real. And at its absolute simplest, all we're saying is more kids need that and more families need that. And we feel like there's a moment to be able to make that happen in a sustainable way. Thank you, Annabelle. Great question. And despite systems not yet being integrated in a way that makes that obvious and easy to do. But there are lots of Cassys and lots of potential Cassys out there and brilliant brains and hearts who are working on this, who have many options with what to do with their lives and chosen this. So I think hopefully others are walking away with a sense of optimism and possibility and hope. I don't think Anthony Albanese actually dialed in today, but people who are close to him and know him and are influential no doubt did. And so the message was pretty clear from our friends here that it's his time to step up with his team and with all of those who are going to be working towards realising the early years strategy and many of the other things that are going on. And the sense of possibility is clear. Despite the systems, we were going to make this happen. Better funding and better enablers will make that happen for more children and more families much faster and in a more sustainable way. So thank you for making that all feel like it's just around the corner. Once upon a time, lots of things that do exist now didn't exist, and small groups of people came up with ideas, made it happen, and then it became a thing that we all expect. I know that Murdoch Children's Research Institute and Social Ventures Australia would love to talk to you and work with you if we haven't already met, and that we are looking to build on the work with more evidence, clearer pointers towards quality. Anyone who knows Albo, welcome to give him a call. He may not return it on this particular topic this time, but you never know. Evidence suggests that this could be one of the really key components that really supports young children and families to thrive. We know here that makes people have better outcomes and better lives, and we know here that that leads to a more productive and economically successful society in the long run. We know that there are existing models, 200 and something of them. We know that there's bigger need and we want to see more. And thank you very much to Lachlan and his team for doing, you know, I know you said it's unenviable, but I'm pretty sure people who work for Deloitte Access Economics actually love doing this work. And we're grateful for being able to partner with people who can turn blah, blah, into, and that equals that many dollars, in a actually quite easy to follow kind of methodology, which is great. The real opportunity here is to create the enabling environment to make this happen, so that more people like Cassy are able to do great stuff on the ground. Deeply grateful to you for sharing the story, to the many centre directors and managers and leaders who have joined, and to all of those who are busy talking to families and couldn't join today. We hope this somehow gets into your hands so you feel seen and heard. Anything we can do to support you and elevate your voices and put you in the limelight would be, we'd love to hear what your ideas are for that. We need to keep learning and planning. These are contributions to the conversations. If you have things that are already in existence that can contribute, tell us. If you've got ideas for what could come next that would be useful in moving this forward, we'd love to work with you. We'd love to hand the ideas around to the people who can make it happen. Thank you to the philanthropists who see this as real work that is useful to support. In this case, the Brian Davis Foundation, Alex Wenderoth, Carol and Tony Berg and Michael Graff Family Foundation have all said this is valuable and we're happy to support. So we're deeply grateful to you. This is exactly the role that philanthropy can play usefully, which is taking a bit of risk, demonstrating what's possible, putting quantification around it and showing governments how and where to step up. As I said, thank you, Lachlan, to your team. Evie Fox-Coob has done a brilliant job in managing this incredible project and including making sure all of this went smoothly today. My incredible SVA colleagues, you're so talented, and every time I see people share in writing or today, I think far out, there are some just terrific folks in this place who work so hard using all of their skills and talents and networks to work towards a brighter future We are going to send out copies of the 2 reports. Feel free to share widely and please read them. We'd love to hear your feedback. Yes, don't just share them. It's fun if you read them. Although if you don't want to, still share them, because that means more people could have the chance to read them. Join Suzie's network, the National Child and Family Hubs Network, coordinated by the Murdoch Children's Research Institute. It's an opportunity to bring that collective thinking, feel validated about, you know, being a hub is hard, and here's how we've done it, and this is some ideas that you might like to share. We'll share contact details of how to do it, so you're not just Googling Suzie's Hub. I didn't test that beforehand. Don't do that. Who knows what might come up. I don't have one. I'm not a Suzie with a hub. And I didn't do any of the sort of search engine optimization on that one. Thank you for your dedication to this important work. Future generations who haven't even been thought about yet will benefit, and I'm deeply grateful for everybody who is contributing their time, energy, effort, brains, etc., to working towards an Australia where all people and communities thrive. So thank you very much. Well done. To our studio audience, there's afternoon tea. If you at home want, you can also refresh yourselves, although I imagine it won't be quite as fancy as the lovely catering here at Deloitte. So thank you, Deloitte, for hosting us and for afternoon tea.